This program is designed to provide general information with regards to the subject matters covered. This information is given with the understanding that neither the hosts, guests, sponsors, or station are engaged in rendering any specific and personal, medical, financial, legal, counseling, professional service, or any advice. You should seek the services of competent professionals before applying or trying any suggested ideas.
Welcome to Behind the Scenes, for your half-assed entertainment news with no bullshit, with our hosts, Summer Helene and Bear Fiorda, only on Talk 4 Media.
G'day guys, welcome to Behind the Scenes. I am your host and future barbecue resident, Summer Helene. We are on with my co-host, the baddest bear in the cage, who doesn't get the microphone right now because I have it. What's his face? And Bear Fiorda, and our very special guest today, Dr. Hyder. I know you guys know her as Dr. Shazia, and we call her Dr. S. Hi. She's going to be burning the shit out of my face today, and I'd like to remind everyone, every time we use bad language, so if we scream it, it's for charity. We give money to the Boys and Girls Club of America, the Humane Society of America, and Free MMA. We swear because we care. Now, I'd like to give a quick shout out before we go anywhere to KMX Stands. Thank you very much. You always give us great hair. Tiny Bubbles Hair Salon. And our giveaway today is from Off-Road Rentals in Palm Springs, California. So if you want an ATV ride, follow Dr. Shazia Hyder. Follow her. We'll have a link in the description of this video. And the first person that follows and tells me what kind of barbecue they think I smell like can win an ATV ride. We also have, when this is done, because we are going to be burning the crap out of my face today. And I got to tell you guys, we're going to be doing a fun series where we burn my face. I'm kidding. It's so we're going to do a before and after. So I want you all to check it out. And I got to tell you guys just straight up, I know we talk about media here. One of the things that happens, Dr. Shazia is going to get me ready while this is going on, and then she's going to explain it after she peels me like a piece of pork.
The burning jokes are just on point.
The burning jokes are on point. So I'm going to hand this over to Bear. He's going to run the show today. I do want to say, because we talk about what goes on in media, speaking of bacon being cooked, Diddy's screwed. Everything that's coming out is getting worse and worse for Diddy. And apparently the Duchess of Sussex was caught up in his thing. I'm not really surprised. I would be surprised. There are some people I would be surprised if they got caught up. Like, we're not going to hear about Julie Andrews at a freak off, but a lot of Hollywood's in trouble. And when we look at it, Austin Kutcher is also caught there. And I'm like, you got caught with your co-star who was accused of rape and convicted on like 30 counts. And now you're stuck with Diddy. I'm waiting to see what comes out about Kutcher now. Because you can't, Ashton Kutcher, you can't be around that many people that do that and be cool with it and not do it yourself. So there is my sum up for today. I forgot half of our sponsors. Oh, shout out to the hotel in Phoenix we're usually at, which we're going to be at again. I'm going to have Bear do the rest of the shout outs so I can get my face done.
I only remember the one shout out. It's Embassy Suites by the Hilton in Phoenix, California. Thank you for putting us up, especially while I'm training out there. Sorry, Phoenix, Arizona. Thank you for putting us up out there while I'm training at the Lab MMA and while we're going to Phoenix Fan Fusion, actually.
Yeah. And Matthew Morris Fine Jewelry.
And Matthew Morris Fine Jewelry.
We usually pepper these throughout the show because they pay, lots of money for that. But I'm not going to be talking, and Bear always forgets them.
She's 100% right. So I guess we normally have our guests coming on after our 15-minute blurb about what's going on in Hollywood and talking about how Diddy is diddling other people without the permission. But welcome to the show. How are you feeling today?
Oh, I'm doing great, thank you. How are you, Bear?
Thank you very much. I'm doing well, thank you.
Did you just use Diddy as a segue to Dr. Shazia?
I'll use whatever for a segue.
You are going to end up not getting Dr. Shazia and get Mrs. Hyder, and she's going to stab you.
That's funny. The Jacqueline Hyde. Yeah, I love that very much. Well, considering the intention is to burn my nipple hair, I very much don't want to create any kind of upset today. I'm safe. Thank you very much. I appreciate that.
Her page, if they want to see your nipples get electrocuted.
You guys have to follow Dr. Shazia Hyder to see me get my nipples electrocuted. That'd be fun. I just realized I hold the mic to you. You have your eyes closed so you can't see what's happening.
It's between you and her. I literally am just the burn victim today.
Yeah. Speaking of which, how do you feel about being a burn victim? Is this your first time?
Yes. Why don't we have Dr. Shazia tell everyone how she's going to barbecue me?
Yes. Would you mind explaining to us exactly what this is and how it's going to take place?
Absolutely. So we have a CO2 laser, which is right here, and that is going to be causing tiny little burns into the skin. And when the skin starts healing, then there's improvement in fine lines, wrinkles, collagen production, skin tightening, acne scars. She doesn't have acne scars. She doesn't really have any wrinkles either, but she's a great candidate for this because she looks great.
I'm losing weight and everything's drooping. You can just speak straight forward.
It's great for skin tightening. We have lots of procedures here which can do skin tightening, but this is your gold standard. So if you're a good candidate, you have to be of a certain skin type, meaning I'm not a great candidate for my own laser just because I am darker skin type.
So it's a racist laser?
Yeah, it is a racist laser. I can lighten it and use it on darker skin type, but Summer's a great candidate. Bear, you're a great candidate.
I don't want to be a candidate, thank you.
No,
you don't want to be barbecued.
No, I don't wish to be barbecued. Which, speaking of which, barbecued human, to my understanding, does not exactly smell pleasant, as you were telling us earlier. And due to the nature of the radio show and the mic setup we have today, we don't have airflow going in through the room to kind of make sure we don't smell Summer cooking. Could you describe to me, to the best of your ability, what that is going to smell like so I can prepare myself?
it's going to smell like burnt human. It's going to be bad. Yeah, really bad.
That is so unfortunate. Summer, you're not ever been a burn victim before, but how do you? I feel bad making that into it. It is the reality, but I feel like it's bad saying that as a joke because people have literally been like in house fires and everything. And I mean, to an extent, yeah, your skin's burning.
The way I look at it is this. It's worth, I've never had this. We'll see, it'll be fun. We'll see how it goes. But the biggest thing is I really think that a lot of people can benefit from a lot of different things. And we try different foods on the show. We go different places on the show. And a lot of people right now, especially because of social media, look for plastic surgery. And I hear all these horror stories about people going on Groupon, or they got this acid peel. Sorry, I jumped in.
Oh, let's say we're about to get started right now.
They get an acid peel and it destroys them.
1, 2, 3. You okay?
Mm-hmm. So I want people to go somewhere reputable. So I would rather talk about somewhere safe in the social media age for people to go.
We can not only see it actually physically leaving marks on our face, but we can hear that. That's the sound of laser just kind of doing its thing all across skin. And there is Summer, you are. Do we have a ball? We do not have something to squish, unfortunately, right now. But we can see like you steaming.
That's right. Yep, that's right. So this is causing tiny little burns onto the skin. And that is what's going to create the magic.
Okay, so basically we're not deep. What is it? Not deep frying or air frying. We're like pan frying her. Right? I don't know how many burn jokes we can turn this out of.
Very, very light burn. Very controlled. So it's done in a very controlled way.
Now, how do you decide what procedures are going to go to which person? Because obviously this Summer is a great candidate for this, but let's say someone who wanted something similar to this, what would they have to do to get this type of, no, not this procedure, but anything that would be close to effectiveness as this one?
Yeah, so microneedling with radio frequency, that's another great procedure. It's also for skin tightening, for acne scars, or just regular microneedling. That's a nice procedure too. So there are lots and lots of treatments which are helpful in the minimally invasive as opposed to surgery.
What's
Wait,
more
this-
effective, micro needling or CO2?
They work slightly differently. So microneedling is with radiofrequency is going to go deeper. This is going to go more shallow, but it's still deep enough to create a skin tightening and a collagen production. I love this CO2 laser. If somebody's a candidate, then I'm going to suggest it because I feel like you get great results just even in one treatment.
Is there any level of excitement that comes from like zapping people with lasers? Is there a little bit of fun in this involved for you?
Yeah, it's a little bit like, so we recently started taking skin tags off, and that's really fun. I don't know, it's just like, popping pimples or something. That's a satisfaction to it. Yeah, it's fun.
Fair enough. Yeah. Summer, how are you feeling down there?
Barbecue.
Yeah.
But everyone will get to see the results at Fashion Week with the UN,
When is Fashion Week at?
the 17th through the 20th.
17th to the 20th. Now, as we're seeing it going like into the cheek kind of nose, or basically center of the face area, is it gonna? Maybe if you're asking you, Summer, does it feel worse in this area than it did in the forehead?
No, I'm just trying not to move my face while she does it. You talk.
Okay, fair enough. I think that's a good plan. But definitely, I would think this hurts a lot more just kind of in this more sensitive skin, or it just all around sucks as a burn.
I don't think it sucks. I think this is for if you're wanting a procedure done, minimally invasive is good. What other things do you do here, Dr. Shazia?
Well, we do a lot of laser hair removal. We do laser genesis, which is a very light laser that would get you kind of red carpet ready. We do PicoSure laser, which helps with pigmentation. This laser also helps with pigmentation too. Kind of nice. And
So those little veins I have on my face?
they are probably not going to help your little veins. Little veins look like they're very superficial, but in fact, they're quite deep from a skin standpoint. So, yeah, they're probably not going to help. But you're going to be glowy. You're also going to be down for several days. I think we've talked about that. So, with this CO2 laser and the settings that I've done on Summer, about a 1 week recovery.
Jesus Christ! A 1 week recovery. So you're essentially burning her, and then you get to lay down for a week. Summer, how do you? I'm sure that's fun. I don't want to ask you because you're moving your face, but I'm sure that would be exciting for some people. For you, not so much. I think just sitting there a little bit extra crispy is not the most fun thing in the world.
Well, not that type of downtime.
I get to work.
Not go and sleep downtime. More like she can't go to a party looking like this.
I'm not
I
going
mean,
to a fashion
It depends
party
on what
tonight.
kind of party. I mean, if it's a Halloween party, absolutely you could go.
That's I'll take that one. I think we should take that one as a compliment. I'm really intrigued by the whole laser process. Is there for example, why are we wearing these glasses now that I think about it?
Okay, so if I do something dumb, which I hope I don't, and let's say I suddenly shoot this laser towards your face and I catch your eye by mistake with the beam, then it can cause ocular damage. So we don't want to cause
Now I understand. I don't wish to have a crispy eyeball.
Does it work on these lines that I get here?
Yep.
Awesome.
Now, apart from the procedure happening directly in front of us, you also have a couple things coming up, including a TV show. Are we allowed to talk about that at this point? So, or can you tell us a little bit about that? Oh, okay.
Whatever we talk about.
Yeah.
Because I know we've got my niece on that. Those require me to be involved. Talk to her. Why don't you ask her about things she does, where she went to school, interview, for God's sake, man.
No worries, no worries.
That's your job today.
No worries. I went to school in England. That's why I talk funny like this. Summer also talks funny, but she's from somewhere else.
She's where your people sent her people when they were naughty.
Yes, indeed. So I'm from London. I was born and raised in London, went to medical school in south coast of England, and then did all my training, did family medicine, and then somehow found someone here, got married, and moved here. i.e. Northern California, and then moved to Seattle, and I had to do residency again, which really was a lot of work. Doing re-qualifying in the US was something else.
Yeah, I heard that it's kind of like a very annoying process because they don't count what you did overseas. Are you like redoing all your schooling and taking all your exams a second time?
Not redoing schooling. So medical school is recognized worldwide, but I did have to do the medical licensing exams, and they were tough. And I had to do residency again, which I'd already done, so that was difficult. But I did internal medicine at Loma Linda, and that was 3 years. It was harsh, but I was ready. I was in the trenches.
I'm sure something a lot of people hear is residency. I hear that all the time, and I don't really know what residency means. I always assume it's people who have to go work at like an ER as punishment for becoming a doctor or something until they can get to go do what they planned on doing out of school.
So residency, so when a person goes to medical school, after they finish medical school, they need to be specific in what they want to do, what they want to practice. What type of medicine? Do they want to deliver babies or see children all day, or see adults? So there are different subspecialties, or they want to go and do surgery. So that is the reason why you have to go and do residency. So for instance, plastic surgery is a 7-year residency. So you finish medical school, and then you have to get in. I did residency twice. So I did residency in the UK, in England, and then residency here. So I did 3 years. What did I do? No, I did 4 years in England, and I did another 3 years here. So I could have done plastic surgery.
Yeah, you did a full plastic surgeon residency.
Yes.
Hold the mic here, Joe.
Yeah.
So I have like little jelly things. Does a laser tighten that?
Yeah.
That's
Yep.
awesome.
Yeah.
And then it does like bags.
Yep.
So I'm telling you girls, this is what you write in and ask me about. You want your gels tightened? Come here. You want the bags tightened? Come here. For all we're joking about the barbecue, I can tell the difference between where I was numbed and where I wasn't. Where I was numbed, I feel next to nothing. She's hit a couple places I wasn't numbed. It doesn't feel great. But we're joking about this. This is not that painful. Really, it's worse to get filler. I'm really surprised how the lack of painful.
And then we usually have the cold air running.
Yeah,
too.
there's usually a little blow thing.
We took this on hard mode in essentially for the sake of the show today.
Yeah, that really surprised me when you guys talked about this. Like Bear is making kind of a fuss about the burning, but it's really I can see why it's considered non-invasive. This isn't what you would expect.
Look, I'm sorry, okay? When my girlfriend's getting toasty, I get a little concerned.
I'm going to show you guys the beam. I don't know if you can see that. There's a square, and then I can customize it. So I can make the beam smaller and smaller and smaller. So now I'm going to work around the eyes because
we're getting real specific now.
Get really close.
So did you know from young age you wanted to burn people alive, or did this come to you later in life?
Oh, this came to me later in life. So I was practicing internal medicine at the VA hospital in Loma Linda, and things were great, except I did get breast cancer later. Well, actually, I was 41 years old.
You were young.
Yeah, so I was young. So October is Breast Cancer Awareness Month, guys. So, ladies, if you're 40 or over, please go get your mammogram, because the mammogram pretty much saved my life, because by the time I was diagnosed, it had already spread. So I went into that whole thing of becoming a patient and getting treatment. And afterwards, I just said, you know what? I'm going to do something fun.
They say doctors make the worst patients. Is that true?
Yes, I was hideous. I checked myself out of Loma Linda, even though I was...
No, you checked yourself out of procedure for cancer?
Yes.
I can't imagine having that level of confidence. I fight people for a living. I'm not that confident.
Yeah.
If I go in there for something like that, I'm listening to everything the doctor says.
Yes, I'm a different level of badass.
That's a fair point.
It's hard when you have the knowledge. It's easy for us to listen.
That's more than reasonable.
Yeah, I was really sick, and I was like, I think I'm getting sicker in the hospital. I need to leave.
And then after you left, that's when you decided that I suppose doing this to people was the next calling.
Yep, I decided I was just going to do procedures which make Summer's not very happy right now, but she will be happy with her results.
What does zapping under my eyebrows do?
Okay, so a lot of people will get saggy eyelids. And so this will tighten it. A lot of people end up getting a surgery called blepharoplasty, which is cutting out the excess skin on the eyelid because you're feeling heavy. So this helps just tighten it. It's like a preventer or treating any sagginess that's going on.
So I'm getting a mini upper and lower blepharoplasty.
Correct.
This is not meant to sound as bad as it will sound, but you actually don't smell too bad being cooked this way.
That's good.
I know.
Good.
This is more than tolerable. I was really afraid that it would permeate the room with the smell of burning face carcass.
Yeah, it can get pretty bad. You can see the smoke.
Yes, it's really coming off her face from there. Again, it just goes to add to the point if she's actually being burned. When procedures like this come up, do you have to have specialized training in this, or is all things covered in like a class?
It's going to be sensitive.
That was a pretty bad one.
No, it just
Yes.
startled me.
I'm going to be right here. Okay. Yes, absolutely. Training. Every single thing that we do here in my clinic, I've had extensive training on, and so have all of my staff. I will not do this unless I'm prepared to do this to myself.
So is what you're saying is everyone in your staff could come and do this, or just specific members of your staff could do this one?
I do this procedure, or my PA, Elaine, and my RN as well. She can do this procedure.
What is the most fun thing that you do for your clients here?
That's easy. Injectables. The results are very quick. If you're a good candidate for filler, you see the results right away, which is really nice. It's like unheard of to have instant results. So in this industry, I love doing filler because with this procedure, she's going to have downtime. But it is it's great to do laser because she's getting skin tightening. Her skin is going to be brighter and it's going to look great.
Absolutely. And just take a moment. I want to say shout out to everyone in the comment section. It is a little bit difficult for us to read right now because of our distance. But if we can, I'll get to them as soon as possible. So don't feel disheartened. I do see that they're there, and I'll come to you guys the moment I have a chance to. Right now, I'm acting as a squish ball to make sure that we can get through this procedure. I don't want to ask how you're doing because I feel like you are momentarily being inhibited, but I will ask that you are now burning her neck. Again, that goes more to the tightening aspect here?
Yeah, so everyone complains about their neck because we always do. Lift your chin up a little. We always do procedures on our face. We have a tendency to ignore our necks. So that is important. We want to have nice, smooth necks. Necks are difficult because they don't produce as much collagen and elastin as the face. And so that's why you see people who are aging, but their neck can look really kind of saggy. So it's good to start early. Please start early doing procedures.
Yeah, I would think preventative is probably better than trying to fix it after the fact. But if I don't have all this available to me, I'm a dude. I have a single bottle of Jergens lotion somewhere under my sink. What are some things I can start doing to better prevent a future need for burning myself?
Okay. Yeah, so a good quality skincare. I started good quality skincare in my 20s, and now I'm 50. So that was really important to just have good skincare. Good skincare means that you're not getting it from a high street brand. You're going to an office, a doctor's office, dermatology, for anyone that deals with aesthetics. So, and people who are in their 30s and 40s are going to really, really benefit from using retinol. That's your magic ingredient.
So is my Gold Bond not good enough in this regard?
No, it's not. Maybe you can put it on your legs, rub it on your feet. That'll do great.
But certainly the face is going to require something a little bit extra.
Yeah, definitely extra. And sunscreen. Do you need a break?
Yeah. Sorry.
No, it looks bad. I'm feeling it. She's squeezing. She's doing a little dance. Actually, yeah. They should hear it for a second. At least hear what it's like. So for just 1 second, we're gonna give her some cold air, and it's gonna be hard to hear us. Oh, okay.
Yeah, it's just this.
So something I'm going to say is it's good in most areas, but I can find the bits where we didn't put the numbing. And so the numbing makes a huge difference. Now, it felt like we did more under one eye than the other, which is funny. I know you didn't. I just got distracted. But I have worse bags under one eye, like this eye than this eye. Oh, I'm
Let's give her more reason to zap your face.
You are crying a little bit.
Yeah.
I can go over it a little bit more.
Like the bags are really like my concern. The bags and neck, ironically, and the next I will say is more unpleasant than the face. It's more sensitive.
I definitely feel the squeeze go on a little bit more for the neck than anything else.
It's not bad. None of it's bad.
Are you ready?
Okay, I'm gonna put this thing back real quick.
Yeah, I don't want you to scare people and make it sound worse. I know Bear's playing.
No, I'm definitely just giving you a lot of like drama right now.
It's not. It's really not that dramatic.
What are you doing right there? You're
I was
cleaning
just
it?
cleaning.
Yeah.
Just some of this. Sorry.
Maybe the two back.
Oh, the tube. Got it. Here you go.
So the neck. Well, the funny thing is, so it's funny.
You
My
ready?
eyes are the ones that I really worry about,
Yes.
and my jowls.
Yes.
And you found one spot on my neck. I don't think we put numbing. And when that one spot got, I was like, holy shit, this would be terrible without the numbing. But
Yeah.
with the numbing, it's not bad.
With the cold air, it's really, really good.
That makes sense.
Yeah, that's the
So
big thing.
I blame the audio. It's your guys' fault. I don't get cold air.
That's a good way to do it.
Okay, are we ready?
Yeah.
All right, let's go over those gels again.
You know, as I'm watching you do this, I see the laser kind of twitching all over the place. Is there a reason this is maybe a little bit more technical than I'm aware of, why it's kind of fluttering all over her face to create the burns?
Yeah, so it's done in a scattered, fractionated way. And in that way, we're not burning all of her skin. If you look, it's burnt in very specific ways. So that way she's going to heal really nicely, but still get the results that she wants.
Does it work on like this section where you get the décolletage? That's what I'm always worried about. It's like the 3 spots I get are my under eyes, right here on the jowls, and my décolletage. And they're the 3 that stress me. And most people don't notice them.
Yep, absolutely. Absolutely. Bear with me.
So as I'm going through this and we see this happening right now, I understand that the main benefits, especially in summer's regard, is going to be tightening. Aside from maybe skin complexion or color, what kind of makes someone an excellent candidate for this kind of procedure?
Masochism.
Masochism.
Anyone with acne scars or fine lines, wrinkles, sun damage. So, oh yes, very important. Sunscreen is super, super important. So you asked about what can I do?
Yes,
You know,
I still,
at
yes.
home, sunscreen is your number one. Get a really good sunscreen. Apply it, reapply it. Make sure it's an SPF 50. And just sunscreens only last 2 hours. This is every sunscreen on the market. So that's how often you have to reapply it. Obviously, you're not going to apply it if you're going to go to sleep. This is during the daytime when you're out and about.
I've always wondered that why they have the different numbers on there and how long it's actually supposed to last for us. Because for a while I thought SPF 30 means 30 minutes. I think that's maybe something most people have the perspective of.
Oh, yeah. No, the SPF is the strength. It's the strength of the...
I have a question. Mike, since I lost weight, my jowls have gotten worse, my eye bags have gotten worse, and that chest spot have gotten worse. Everything else is fine, but you've been putting Botox and everything else, so that probably helped. Why those areas?
Well, these are gravity-related areas. These are very typical when people... I have so many patients on semaglutide, and whether they're with me or not with me, they're coming in and complaining of the same thing. There's gravity-related issues. Everything's going south because you have deflated, essentially. It's a deflated balloon. So that's what's happening. And you're feeling it along the gravity areas.
So I'm hitting it here and under my eyes on my...
If you lose more weight, then you'll notice more.
Oh, good. Well, I'm going to.
If you are an extremely active person, you do a lot of sports or you do a lot of physical activity like weightlifting and running, how much more essential is either this procedure or maybe your preventative care?
Yeah, absolutely. Very important. They go hand in hand. I mean, you're taking care of your health, right? So why not take care of your skin health too? Because it's the same thing. You want to eat right. It's a whole lifestyle. It's like a religion. You're practicing and you want to stay healthy. You want to keep your skin healthy. You want to drink lots of water, not smoke, alcohol in moderation, that kind of thing. So this all goes hand in hand.
What's the one thing? If people only did one thing.
Or to take care of their skin and whatnot.
Wear sunscreen.
Just wear sunscreen. That's it. I can ditch everything else as long as I just put on sunscreen.
Well, you did ask just one thing, and if we're taking baby steps, I mean, if you come to me, I'll throw everything at you. But if you just want one thing and you're sitting at home, you're like, oh, I really, I'm in my 30s or in my 40s. I really don't want to age, but I can't afford anything more. Then just make sure you have a nice sunscreen and you're applying it and reapplying it. That's going to make a big difference. And drink lots of water. That's free, right?
That's fair enough. And for that, I want to say that's good as well that you do these the way you do and what you offer to your clients, because it is affordable and people can come here and get those procedures you otherwise may not be able to.
That's it. This is definitely, so I'm going to tell you guys, she is cheaper. This is not an ad. And I am going to say, I am doing a show with her. That's not why I'm saying this. She's in one of my TV shows. She is cheaper and better qualified than anyone you are going to find. And I am tired of hearing people online, because I get girls coming to me going, I found this person on Groupon. Don't fuck around with your face. Go to a professional. And if money's tight, I'm telling you, this is where to come. She is better priced than anyone you will find in Beverly Hills. So that is just a personal shout out. That is not an ad. That is a actual personal shout out. Obviously, watch the show with her in it. That's my work shout out. But personally, really, don't mess around with your face and stop buying things off Groupon.
Yeah, I just say I got the question that came to my mind. Gentlemen typically aren't super concerned about skincare, and I say that myself as being one of those members. And I started recently trying to advocate and get people involved and take care of their skin, because it is a manly thing to do in a sense. But do you have any advice for the maybe young men out there who see this as a hassle instead of a necessity to take care of you, or even just see it as a woman thing instead of a universal, everyone should take care of their skin?
Yeah, you know what? As far as clients go, yes, the females are coming in. The females have got it. They know that, oh, I have to take care of myself. And I would say my practice is about 95% heavy on the females. But males are catching up. They're realizing, oh, you know what? This stuff is good stuff. It actually works. And these women are looking younger and younger. So the guys have to catch up. But yeah, start with sunscreen, start with really good skincare, go to a doctor's office and get good skincare. And that will make a huge difference. And then when you're ready for other things, I have a lot of male clients that come to me for Botox and filler. You will be surprised.
Why do you think a lot of men would choose not to come get procedures done or choose not to take care of themselves?
No, but you're a man, you know that.
Well, I think there is a lot of perception that this is just for females, which is just not true. It's for humans. If you have skin, then you need this. It's as simple as that.
That's
I love that. If you have skin on your body, this is for you. Take it someone who, for some reason, doesn't have skin.
I think it's interesting. Like for me, my under eyes, my jowls, my décolletage, and then these lines right here by my mouth and here. They're the ones.
For the gentleman in the audience, décolletage means chest. I want to bet. I know I didn't know that. Maybe other people didn't know that as well.
They're the areas that stress me. And especially since I lost weight. But with Bear being punched in the face all the time, he has a whole different problem.
Yeah, that's an interesting point. I'm not the only mixed martial arts guy who participates in taking care of themselves or attempting to, or who even watches the radio show here. So you have advice for people who maybe go under extreme duress to their bodies and what they should be doing.
Extreme. I don't think it's
Just very careful with replenishing, being hydrated. That's really important. You know that. And just there. So diet and lifestyle are key. You're already exercising a lot. Careful with your joints too.
How did they save their face from getting beat?
How do you save your face?
Because these guys get punched.
Block, yes. Avoid getting hit entirely. Move your head, put your hands up, all the good stuff. How do you avoid your face getting messed up in this sport? Fight better. I love this. But it's true, though. That has an air of truth to it. That is kind of how it's supposed to go. Some of the best fighters right now still have relatively decent-looking faces so they don't get smashed all the time. As she points in my direction. I'm pretty good at defending my face.
All right. What is this?
No.
No? Okay.
Just want to be careful about zapping. Do you not want to zap scars when doing this?
Oh, I absolutely want to zap scars. So I can treat scars. So if you have an appendectomy scar or some kind of surgical scar, I can treat it with this.
Oh, how cool.
Yeah.
Okay, so it just is this really only for the face, or is this kind of like a universal all over the body, whatever you really need sort of thing?
I can use it anywhere on the body. So if there's a scar on the body, I can use it. But most people are coming in for their face, neck, chest.
I mean, yeah, that makes sense. It's the thing you present to the world most often, so you want them to see.
The scar.
Did we run the Pico over that in the past?
No, nothing.
I can give it a go. We haven't numbed it, but
I'll live.
okay.
I'll live. Let's give it a try.
And I'll tell.
Well, for everyone who doesn't know, the Summer does have a significant scar on her shin, and so I think we're going to try and burn that too, on the off chance that it works.
And then I'll tell you guys what it feels like without numbing.
Right.
I'll scream.
How do you want to do this? I need your.
I'll move whenever you're done here. We can go there.
Can you? Yeah. Okay.
Are we done?
Yeah.
All right, so we're going to move,
I'm gonna
switch.
show them my face.
We're going to switch ourselves around. Watch out for the setup if you can see some.
So look at my face. Like I said, so I'll show you guys at Fashion Week. The places I'm most worried about, of course, are here, the jowls, and right under the eyes. Because that's where I'm worst. Now I'm going to move my leg.
So while Summer's shifting herself around,
I don't have flash.
hopefully you don't flash anybody.
We're good. I'm going to tilt it down a little bit.
Do you often work
I
on?
have the scar right there, you guys. I'm going to tilt this.
We tilt probably a little bit more just so they can see it.
So we'll try it on the scar.
Does this work particularly well on scars, or does it just happen to also help
Do I
with
get
scarring?
glasses or-
Like, I'll put my little.
It works particularly well on scars.
So why does zapping it more times make it work more? Like you went more under those areas I was worried about.
It will make it. It will just be more aggressive. It's more aggressive of a treatment. So whenever people say, "Oh, I'm more worried about this area," or sometimes I identify, they've got jowls, so I'm going to go over it twice.
So how does going under the eyes twice? Like, because I've got the lines and the bags. Does it tighten bags?
Yeah.
'Cause I know that's the main complaint
Mhm.
from a lot of
the women. So I'll show you my bags after. You've all seen them on average. All right. Yeah.
Next time, I will be sure to have 2
I'm
microphones.
just gonna do. Can you see?
Yeah, we can see it.
Yeah.
Wow, that immediately took away a lot of the color, actually. Or is that just the skin being fried on top of it?
Yeah, it's being fried. There we go.
So y'all look. Actually, that changed the color immediately.
That couldn't have been pleasant. You said it hurt, that one?
That was substantially worse, but it's worth it. I hate that scar because I wear skirts to work. So if that can go away, that is all that matters to me. So you said the more aggressive. I'm like, can we do this 9 more times and will it just go away or my leg fall off?
How many times can we do this before it's
I
detrimental?
think we're good. I zapped it about 4 times, and we can always zap it at some point again.
Oh,
Slowly, slowly.
Okay.
this was the next thing I was wondering. Is this a one and done kind of procedure, or is this you coming back for
Right.
multiple treatments?
Okay, very good question. So this is a one and done procedure. Having said that, with the skin, nothing is forever. You know, it's like saying, oh, I'm gonna go to the gym today, but I've been to the gym this month. I don't need to go again, right? Does it work like that?
No, of course not.
So it's the same with the skin. So this laser, I would not repeat for another 4 to 6 months. So if someone is very sun damaged, lots of fine lines and wrinkles, then I will do this again in that time frame, 4 to 6 months. But she needs recovery time now. She's going to need a week of applying Aquaphor. I'm going to apply some Aquaphor to her face, and then she's going to have to treat it like a burn. You're going to have to treat yourself like a burn victim. So you're applying and reapplying the Aquaphor. But this is a great procedure. That's why I like this procedure, because I feel like you get a lot out of this one treatment, as opposed to some of the other treatments, which are a little bit more delicate. And we have to do a series of, which is fine because people have different lifestyles. Like people are teachers, they have to work with kids, or they work with the public, and they can't just look like this for a week and be scabbing and flaking and look weird. So they need to have, they need to look presentable. So then I'm going to suggest, okay, well, we have this laser, which will not give you any downtime, or we could do this microneedling procedure and that will not give you downtime, but we have to do a few of them. So it depends on the person, their lifestyle, their issues, and their budget, of course.
Shout out.
That makes sense.
Shout out. You wanna do the shout outs real quick? You've got a
I'm
whole
try-
bunch of people on there talking to you about.
But from what I can see, shout out to Thoheed, Sniffy MMA, and Lee Mitchell. Thank you guys for writing in comments. And if there were more, I would have seen more. I'm sorry.
If you want answers to this, please follow Dr. Shazia. And you'll see her on the show. And I'll show you guys on the 17th. We'll be on the red carpet. I'll drag Dr. Shazia with me. And we'll show the results on the red carpet for Fashion Week. I'm going to be with Prince Mario Max. So we'll be with him.
So we've seen, can you lift that up a little bit so we get ourselves back in the frame? What if I were to do this, would you want to zap on my face?
Right. So with men, sometimes they're really attached to their facial hair. So if I can convince them to do a clean shave, that would be great, because he's already getting.
All right. So let's say let's say for the purposes I did shave,
Yes.
and then the
Then-
next step.
Then you get you a nice shave, because it's already toasty in here, right? It smells like burnt skin. So imagine it smells like burnt skin and burnt hair.
Is that going to affect my hair growth if I do that on my face? Does it make this harder to come back?
No, it will not. But there's I have treated men who just said, no, I cannot shave my facial hair. And I said, that's absolutely fine. Just trim whatever you like, whatever you want to treat, and I'll just work around it. Meaning I'm going to focus up here, your nose, and then just call it a day.
Makes sense.
He has the wrinkles, and that's mostly from smiling because he's a smiley person. But he's also got sun damage on there. Does that help with sun damage?
Yeah, absolutely. Yes, because I know you can't do Botox because of
Yeah.
Getting
because
punished
then
because
if someone
of
hits me in the
issues.
face, it's going to move.
because of issues, but
Well, I'm going to tell you guys, part of the reason fighters aren't allowed to do Botox is if there is something not moving in their face, there are actually physicians to watch to see if they have neurological or physical damage during a fight. So they use that to check. And they found this out because a fighter, one of the Diaz's, I'm not going to say who, did that, got Botox, part of his face didn't move. So they pulled the fight, sent him to the hospital. They thought he had neurological damage. So they're not allowed to do it now.
Just want to say they do check that stuff before fights, especially. They go through a whole physical. They're touching your face. They're touching your chest. They're having you jump and make different expressions because they're trying to make sure that you are within your own devices, I think is what the right phrase there would be, just to make sure you're not partially brain dead, I'd say.
So how do you fix somebody that can't get that?
Oh, okay.
So we'd have to do a laser procedure, laser, microneedling, something like that.
Well,
Can I opt out of this?
well, you very much enjoyed when she electrocuted your nipples.
So here's the thing. I did enjoy that, and I enjoyed that because it did not come back for a long time. The procedure itself, I'm a big baby. I did not enjoy the laser zapping aspect of it, but someone out there might. There are different people all over the place who could get a good kick out of it.
Well, we're also going to have Moni Slaughter from Love and Hip Hop come in, and she's getting her vagina done. We can't show that part. But I'm going to say, if you recommend one thing here for the first thing for people to try, what would you tell them to try?
As far as a treatment?
Yes.
Oh, that's a really difficult
Because
question.
we want them to come back.
Oh, okay. Well, we do great facials here. So if you're not into kind of being zapped or burnt, or you just want to tiptoe into aesthetic procedures, then come and see our esthetician. She's amazing. I see her at least once a month. I get my face pampered, and you can get some microdermabrasion, and that is not painful at all. I promise.
You know, I had one more question, but it might be a bit too technical for the time we have. How is the laser zapping going to actually directly impact your skin? Like, why did we do a laser instead of like skin her with a rusty knife or something?
Yeah. So you want to keep away from rusty knives because you just don't want to get sick, and that would leave her permanently scarred. So laser companies have come up with extremely fancy lasers. This one's from Italy. It's called the Deca machine. It's the original. It's the original CO2 laser.
I'm telling you guys, that's not an app. We just wanted to show you.
Yeah.
Yeah, it's a really cool looking thing there.
Actually a machine. So yeah, do not do crazy things at home. Okay. Don't start burning your brother or sister's face, because
So wait, if I took a magnifying glass and used the sun, is that going to give me a similar effect here? Just kind of guiding the line all over the place?
so you're going to get probably smack in the face from Summer. But I would, the laser is great. People have great results, try it. I guess you can't, it's very easy. There's a whole culture out there right now in Hollywood. I've noticed everyone's just like, oh, grow old gracefully and all that stuff. It's there. I don't want to name names, but they're there, and they're just very anti this and anti that. And I'm thinking they haven't gone to anyone reputable or professional, because there's a lot of things that I can do. I don't have to inject Botox. I don't have to do filler. We can do really natural procedures. Like there's a procedure called platelet-rich plasma, where I take your blood, I spin it down, I make it into a serum, and then I can microneedle the skin, and the skin will naturally regenerate. And I'm using a serum which is specific to you. You can't get that serum anywhere because it's made out of your blood. So, and I just take very little blood, and then I make the serum, and then I microneedle the whole face, neck, whichever area wants to be treated. And that's going to help with fine lines, wrinkles, skin tightening. And sometimes we have procedures with downtime. Sometimes they don't have downtime. But whatever we choose to do, there is a procedure for you. So it can be as natural or as unnatural as you want to. And if you fill your face with filler, then, there's going to be some different results. Like I can do Summer's lips right now, and they're going to swell like crazy. They're going to look really pretty after a week or so. But I think don't knock the whole industry, because there's something gentle out there for you if you're ready for it.
I absolutely love that. Now I'm sorry, one second. I had a quick question. You mentioned the plasma thing. So you're taking blood out of my body, you're spinning it, and it's I don't think maybe I'm incorrect here. It's separating a little bit. Is that what it is? You're trying to pull it
Yes.
things
Correct.
apart, and then you make that into a serum. What else goes into the serum, or is it just purely what comes from your body?
So this is purely your blood. I put it into a tube, just like when you go get blood taken, it goes into a tube, and then I spin it, and then there's a separating agent which will separate the red blood cells and the white blood cells, and it only leaves serum. It will leave the yellow part of the plasma with platelets, and it's the platelet-rich plasma which is going to help. It has growth factors, and it helps stimulate the collagen in your skin, and it's just it's the ultimate beauty treatment. And we've been using PRP in the industry for decades. It started with the orthopedic surgeons. They started using it for tendonitis, for joint injections. They still do. And sometimes I think insurance doesn't cover it for some reason, probably because it's natural and nobody has any money to make out of it. But it's being used in the medical world. It's used for wound healing. It's used for so many reasons. So in the past decade, the aesthetic industry jumped on and said, hey, if that's good for wound healing and for joint regeneration, then why isn't it good for our skin? And hey, everyone's getting it done. There are some big celebrities who have got microneedling with platelet-rich plasma done. You could go on the internet and you will find it.
I just want to say that.
For hair growth, yes. So we inject PRP and I microneedle the scalp. I also recommend supplements and sometimes medications for people who are losing hair.
All right, I think
I'm going to say, well, one of the questions we asked, what is the most dramatic thing besides a facelift out of all these things someone can do that's going to have the biggest effect? And then we'll jump off it and then tell them where to follow.
I would say what you just had done is one of the most dramatic things that you can do. I would also say that, you know, when you're painting a picture, you have to use different colors, right? So it's not just going to be one treatment. We're not just going to do laser. We're going to do neuromodulators like Botox. We're going to do filler. We're going to do other, maybe PRP, microneedling. So there's lots of tools in the toolbox which is available, and I pull them out appropriate to the person. But yeah, if you want a big bang, then it's difficult. It depends on you. You have to come and see me, and I have to see you so I can see what your issues are. It's very hard to give a really blanket statement.
exactly.
So I'm going to say, guys, thank you for joining us for my barbecue. Do you want to do the wrap up? I am going to go put Aquafat on my face.
Yes, absolutely. So real quick, guys, thanks so much for joining us for the show. It's been fantastic having everyone.
Sorry
Thank
for
you very
showing
much.
I have baby powder all over my feet. Sorry for showing you that.
Thank you, Dr. Shazia Hyder, for joining us. Where can everyone go and find you or your business on social media?
Okay, so my Instagram page is at Dr. as in Dr. Shazia, Shazia Hyder, Hyder. Sorry, I have a really difficult name.
Oh, it's great. Just think of it this way. Like I said, you'll either get Dr. Shazia or Mrs. Hyder, so don't piss her off.
I love the Jekyll and Hyde joke. Thank you guys for
the show.
It will. Thank you guys for tuning in. Have a great day. What do I always say? Oh, yes. See you next week. Good night.
This has been Behind the Scenes with Summer Helene and Bear Fiorda, only on Talk 4 Media.